Good evening, doctors. Welcome again. Our today's topic is paranasal sinus. Guys, I am going to promise you in ENT, if there is 5 question or 10 questions they are asking in an exam out of 300, you definitely receive one question from this table. 100% sure. So, guys, first is paranasal sinus or nose, maxillary sinus. It is first developed 12 to 3 months intrauterine life. It is the largest sinus. Adult volume is 15 ml and age onset is 15 to 18 years. It fully developed. Second is ethmoid sinus, is anterior and posterior ethmoid cells. Okay. Now sphenoid sinus, you have to remember pneumatization starts at the age of 2 years, and this is the deep last to appear on plain x-ray. This is the deep sinus which is last we see on plain x-ray. Now frontal sinus last to develop just after skin visible on x-ray 4-5 years of age. Okay. Now remember this table, guys. They are asking such questions. Sinuses, maxillary sinus, we see sinus present at birth, x-ray appearance and adult size. So maxillary present at birth, ethmoid birth, sphenoid birth, but frontal no, not present at birth. First X-ray appearance, first maxillary on 4 to 5 months age, ethmoid 1 year, sphenoid 6 to 7 years. If you know it's deep, that's why late, and frontal is 4 to 5 years. How to remember? 4 5 frontal, 6 7 it's sphenoid, 1 year it's ethmoid, and maxillary 4 5 months. Adult size it appears maxillary 15 से 18, सबसे पहले हो जाता है ना 15 to 18, तो एथमोइड क्या है, छोटा है थोड़ा सा, इसलिए 12 ईयर्स. फिर हम स्फिनोइड और फ्रंटल को कैसे याद करेंगे? 15 18 मैक्सिलरी है तो स्फिनोइड 15 है और 18 अपना ये फ्रंटल हो गया. एडल्ट साइज ले लेगा, तो इसको याद रखना है आपको. नाउ सम क्वेश्चंस आई एम गोइंग टू आस्क. साइनस नॉट प्रेजेंट एट बर्थ, एज यू नो frontal is not present at birth, so frontal is answer. Sinus last to appear on x-ray, as you know frontal last to appear on x-ray, sorry, not frontal, last to appear on x-ray is sphenoid. Why this is sphenoid? Because it is more deeper, that's why. Now question, most common x-ray view for paranasal sinus is Waters view. Okay, what is Waters view? Nose and chin position, occipitofrontal position, x-ray beam behind both touch the x-ray plate. I will explain you what is Waters view. Sorry, this is a Waters view. What is the Waters view? Waters view, we see here the mouth is closed in Waters view. We visible maxillary sinus, and this one is frontal sinus is visible. Here ethmoid sinus is visible, and but not visible is sphenoid sinus here. This is in closed mouth, but in open mouth ethmoid sinus is visible. This is Payer's view. Okay, we will discuss later. So about I already clear here. Now next table, I explain here Waters view same like there. This is frontal, we see diagram. This is ethmoid, this is nasal bone, this is maxillary sinus, and closed mouth. When mouth is open, sphenoid is visible. This is known as Payer's view. Okay. Now discuss some question. Which sinus best seen sinus at Waters view? Waters view में जो best दिखता है that is maxillary, and after that anterior ethmoid. Okay. Now question, which sinus not visible on Waters view? It's sphenoid, but best one is posterior ethmoid is not visible. Best one. If both are in choice, then go for posterior ethmoid. Best view for frontal sinus is Caldwell's view. Forehead nose touch. This is known as occipitofrontal view. This is known as occipitofrontal view. We can watch this. Okay, not visible here. Sorry, but I will explain you how. Forehead touching, like this is forehead, this is nose, and this is mouth. My painting is little bit. So forehead is touching on the plate and beams come from behind. This is known as Caldwell's view for frontal sinus. So guys, I hope you learned this table and revise this table in examination. Definitely you are going to receive some question from this table. I am sure from ENT every year there is some question from paranasal sinus. So please revise this table again and again. So guys, have a good day. Goodbye. That's all for today. If you have any queries, any question regarding this, you can ask me, and better to solve MCQs after that. Okay guys, have a good day. Goodbye. That's all for today. And if you still not subscribe my channel, please subscribe.